Hey, Michelle, it's nice to see you.
Hi, Cher. How are you?
I'm great, thank you. I'm glad you could take some time to meet with me today. I just want to, get go over the interview, go over your resume and stuff like that, and ask you some questions, and of course, answer any questions that you might have today.
Okay, that sounds great.
Okay, so we'll just get started. Um, for the interview, like I said, I will be, asking you some questions, looking over your stuff and getting feedback just on maybe some situations that you might be in. I want to give you a little overview of the job description. So, for the house supervisor, we work 3 12-hour shifts a week. The I know that you have a copy of that job description, but what you things that you probably need to know about are the main goals of the job are to make sure that the staffing is good in the hospital on a daily basis. Besides the staffing, though, there are plenty other things that come along with it. You want to make sure that you're sending the right nurses to the right units. You want to make sure that you're using the resources in the best possible way. And also, you would be in charge of transferring the patients, making sure that they get there in a timely manner, especially patients that have to go to ICU and things like that. Plus, plenty of phone calls from physicians looking for things in the hospital, trying to communicate with others, setting up surgeries in off hours, and things of that nature. So I just wanted to, let you know about some of those things.
Okay.
Okay. And if any time in this, you have any questions, just stop me and let me know. Okay.
Okay, thank you.
All right. So I see on here that you have 13 years of nursing experience, which is great. Some of that from UMC and plenty of years right here at Tulane. So tell me about your job right now.
So, right now, I'm actually the charge nurse for the neuro ICU at the downtown campus, and I've been doing that for about the past 5 years.
Okay, great. So you already kind of know a little bit about leadership. So that's awesome. I'm going to ask you a few questions and just give me your, honest feedback on them, and we'll go from there. Okay. So
Sure.
my first question is, how have your educational and work experience prepared you for this position?
So, I think being a charge nurse for 5 years, I've definitely gained some leadership skills dealing with people. And I've also been involved in the charge nurse leadership classes that HCA offers at Tulane. So, that's given me a good solid foundation.
Yeah, those classes are great. I've actually taken those classes myself and really enjoyed them, and they taught me so much. How do you think a supervisor can establish effective communications with staff?
So I think just frequently rounding on them and making sure that they know what's going on, keeping them in the loop, asking for, verbal feedback to make sure that they are understanding and just closing the loop on any um, feedback that needs to be done before the shift ends.
Okay. What do you think that your strongest leadership skill is, and how is it going to assist you in this house supervisor role?
So I think with having 13 years of ICU nursing experience, I'm very confident in my nursing skills. So having that is a big help for the staff who maybe aren't ICU nurses, or if there's a patient going bad that needs to be transferred. I think that I'm in a good position where I could step in and help some of the nurses who aren't experienced in critical care.
Yeah, I think that's great. How have you handled special responsibilities or assignments that have been given to you that may not be a part of your routine? I'm sure this happens to you frequently.
Well, for sure. But the way I feel is that the patients are all our responsibility and nothing's never not my job. So whatever it takes to take care of a patient is something that I'm going to do.
Right. Um, okay. And finally, my last question, formal question, is what what do you think that good customer service involves?
I think I'm frequently rounding on patients, making sure that they have everything that they need, making sure that they're informed of what's going on, what medications they're getting, if there's a delay in their care or treatments, letting them know not to be waiting on something, and if we have a delay, and also caring for the patient's family as well, and making sure that they're all informed of what's going on, who to call if they need anything, and that we'll be back to check on them.
Right. Okay, well, a few things that I wanted to let you know about the house supervisor role, besides the job duties themselves, are we have 2 full-time day supervisors, we have 2 full-time night supervisors, and then we have 2 PRN supervisors that kind of fill in the gaps for us. So it's not like your typical nursing floor where you might have 4 or 5 nurses. So if somebody calls in, somebody just steps in. Sometimes we might call you because somebody called in, and we might call you at 5 o'clock in the morning and say, can you please come to work today? So I just wanted you to just be aware. There's no mandatory overtime, but there are opportunities for overtime for sure.
Well, that's definitely something that I'm interested in, because I work a lot of overtime now with the unit being short staffed as it is.
Okay, great. So that'll remain the same for you. So that's a good thing. I think that you have great energy. We'd like to see that, of course. We know you have some leadership skills. Be a transition for you, but you've already got the foundation. So I'm really excited about that. So I guess in our going forward, what you should kind of look for is to get a call from the recruiter in the next 7 to 10 business days, and then we'll go from there. Okay. Sometimes we'll ask for a second interview. Sometimes we'll just go ahead and start the process. But either way, we will let you know something in about 7 to 10 days. Can you think of any other questions you might have right now?
I don't think I have any. I think I know pretty much what the job entails, and I've been in the 2-lane system, so I have a pretty good grasp on how things work.
Yes, and that is definitely a plus for you also, that you know the system, where we are. So that's great. And I really enjoyed, talking to you today.
Yeah, I enjoyed it as well. Thank you so much.
Okay, I hope to see you soon.
Thanks. Have a great day.
You too.
Bye-bye.